I want to make this video to kind of introduce myself. If you're thinking about maybe doing something in the cosmetic world that I can offer, maybe I'm the right surgeon for you. Just a little bit about me. I was actually born in Indianapolis, so I'm sort of a Midwest kid. However, by the age of 10, I moved to North Florida with my family and grew up there for middle school, high school, and actually went to the University of Florida for undergrad and medical school. So I was there for quite a long time. I feel like I got a really amazing education, both undergrad and med school. It's a fantastic program, a lot of hands-on experience. It really prepared me for what I do today. During medical school, I got married to my wife Pam, and we had our first child actually before I graduated. Then we moved to Oklahoma for my residency. So we were in Oklahoma City for 5 years for internship and residency. It was fantastic. Amazing education. My mentors were fantastic, really great surgeons, great people, and I feel like it prepared me for what I'm doing today. The surgical experience I got was second to none. For head and neck surgery and facial plastic surgery, what I primarily did back then, I think it's one of the best in the country, and I feel like the skills that it gave to me, the experience that I got, makes a really big difference in how I could serve my patients, how I could potentially serve you today. After that, I did a fellowship focusing on cosmetic surgery, still a lot of facial plastic and reconstructive work, facial cosmetic work primarily, and then I also started to do more body contouring with liposuction and breast lifts and tummy tucks. And so after residency and fellowship, I had extensive training, just like 14 years after high school of education, and thousands of cases, surgical procedures that I did, not only with my mentors and my attendings, but I did a lot on my own as well. So fast forward to 2006, 2007, set up my own practice in North Georgia. By then we had 4 children, set up an amazing practice. And after a couple years, we migrated from North Georgia to the Chattanooga, Tennessee area because I had so many patients from that area, from North Georgia and into Tennessee. Kind of that's where we are now. So it's about 15 years ago, and I've been in practice, private practice ever since, serving the patients of East Tennessee, North Georgia, North Alabama, and really a lot of surrounding areas. That's kind of a little bit of history of kind of where I started, where I am now. Most of the work I do now is in the Chattanooga area, North Alabama, and really I've gravitated towards Nashville. I have a lot of patients from Nashville, so started working with the surgery center in the Nashville, Tennessee area. And even beyond there, we've done quite a bit of work outside of the Nashville area as well. But a little bit more about me, more personally. As I grew up, I actually didn't want to be a doctor when I was a kid. My mom was a nurse, my dad was a veterinarian, and I actually didn't have much interest in that, which is very strange now because I love it. But at the time, I was most interested in music and art. So I started playing piano when I was about 6 years old, and I took lessons till I was about 15. Played in multiple bands. We have several albums. I have actually a CD with some of my own composed music on. And also, actually even more than that, I was an artist. So I loved watercolor painting. I can remember back being 8 years old, I would sit in my room and paint pictures. I would spend hours all day. Not that I didn't get out with kids in the 70s and 80s. Of course, we rode bikes and played outside and climbed trees, but music and art really was kind of my passion, even up through high school and even into early college, because I really thought I was going to go to art school prior to deciding that I wanted to pursue a career in medicine. I have a good understanding of taking someone from here to there and taking someone who's unhappy with a certain part of their appearance, or they feel like they're looking older and they want to look younger. I feel like, to me, it's kind of easy to make that transition from, I don't like this and I think this is what I want to look like, and I kind of know the steps I need to take to get there. With my innate abilities plus my extensive experience, now it's over 20 years and I've done more than 10,000 surgical procedures. I feel like my patients get a really, really good result with great experience as well. So customer service and customer experience, the patient experience is critically important to me. So really my goal is that you get a fantastic result, very natural looking beauty enhancements, but also it's a great experience along the way. Sort of in conclusion, that's a little bit about me, and things that I love to do now is primarily focus on body contouring and facial rejuvenation. What I'm really known for is facial rejuvenation, so full face, neck, surgical procedures. I do use a lot of technology, lasers, radiofrequency, microneedling. I do a lot of fat grafting, great with Botox and fillers as well. But facial rejuvenation for certain is kind of the thing that I'm most passionate about. I think I'm really good at it. I can tell you all day how great I am, but really the bottom bottom line is look at the before and after photos and you can judge for yourself. If you're interested in coming to see me, coming for a consult, we do virtual consults and in person. I would love to see you. My website is www.neasecosmeticsurgery.com. Social media, Dr. Carey Nease is easy to find on Facebook and Instagram. Phone number's on there. You can call and get an appointment. I'd be happy to see you and try to take care of your cosmetic needs. And I'm Dr. Carey Nease, and we'll see you soon.